When should I start feeling fetal movement? Prima-gravidas, first-time moms, typically between 18 to 25 weeks. Multigravidas, women who have been pregnant before, often feel movements earlier, sometimes as early as 16 weeks. What does fetal movement feel like? Early, gentle flutters, bubbles, or taps. Later, kicks, jabs, rolls, somersaults, hiccups. How often should I feel my baby move? There's no single right number. Key: pay attention to your baby's pattern of movement. What is the kick count and how do I do it? A simple way to monitor fetal activity. Method: find a quiet time when you're relaxed, note the starting time. Count all fetal movements, kicks, rolls, punches until you reach a specific number, usually 10. Record the time it took to reach that number. What if I don't feel my baby move as much as I think I should? Don't panic. Babies have periods of activity and rest. Try having a sugary drink or snack. Lying on your left side, gently rubbing your belly. Is it normal to have periods of decreased fetal movement? Yes, it's common. Possible reasons: baby sleeping. Your position, your activity level. What are the causes of decreased fetal movement? Placental insufficiency, reduced blood flow to the placenta. Cord compression, umbilical cord being squeezed, premature birth. Maternal conditions, high blood pressure, diabetes, etc., fetal growth restriction. What are the risk factors for decreased fetal movement? Maternal age over 35, smoking, drug use. Multiple pregnancies, pre-existing medical conditions. How can I increase fetal movement? Eat a light snack. Drink some juice. Lie on your left side. Gently rub your belly. Listen to calming music. Take a warm bath. What are the best times of day to feel fetal movement? Evenings, often a period of increased activity. Can certain foods or drinks affect fetal movement? Sugar may temporarily increase activity. Caffeine, moderate amounts generally okay, but excessive intake may have some effect. Does exercise affect fetal movement? Usually not significantly. Exception: intense exercise may cause temporary slowing of movements. Does stress affect fetal movement? Yes, stress can sometimes reduce fetal movement. What is the significance of fetal movement patterns? Important indicator of fetal well-being. Consistent patterns help you recognize when something might be amiss. Can I tell the sex of my baby based on fetal movement? No, there's no scientific evidence to support this. Is it safe to have intercourse when I feel fetal movement? Generally, yes. Exception: if you have a history of preterm labor or other complications, consult your doctor. Can I tell if my baby is in distress based on fetal movement? Decreased or absent movement can be a sign of potential problems. However, it's not always easy to interpret on your own. What should I do if I'm concerned about decreased fetal movement? Contact your doctor or midwife immediately. When should I contact my doctor about decreased fetal movement? Anytime you're concerned. Specifically, if you notice a significant decrease in your baby's usual activity level. If you don't feel any movement for an extended period. What tests may be performed to assess fetal well-being if movement is decreased? Non-stress test NST monitors fetal heart rate in response to movement. Biophysical profile BPP combines NST with an ultrasound to assess various fetal parameters. Contraction stress test CST evaluates how the fetal heart rate responds to contractions. What is the significance of hiccups in utero, normal and common? Sign that the baby's nervous system is developing. Can I feel my baby's hiccups? Yes. They often feel like a series of rhythmic bumps or jolts. Is it normal to feel my baby's head or other body parts? Yes, especially as the pregnancy progresses. Can I feel my baby's heartbeat? Usually not. A doctor or midwife uses a special instrument, fetal Doppler, to listen to the heartbeat. What causes sudden bursts of fetal movement? Many reasons. Sudden noises. Changes in your position, your own movements. Baby's response to internal stimuli. Can I prevent decreased fetal movement, maintain a healthy lifestyle, eat a balanced diet? Get regular exercise, manage stress, avoid smoking and excessive alcohol. How can I best position myself to feel fetal movement? Lie on your left side, sit or recline quietly. Are there any specific techniques to encourage fetal movement? See how can I increase fetal movement, above. What is the difference between fetal movement and Braxton Hicks contractions? Fetal movement, baby's movements within the uterus. Braxton Hicks contractions, tightening or firming of the uterus, often painless. Can I use a fetal Doppler to monitor fetal movement? No. Fetal Dopplers primarily detect the heartbeat, not general movement. Are there any apps that can help me track fetal movement? Yes. Several apps are available that can help you record and track your baby's movements. What are the long-term effects of decreased fetal movement? Potential risks: fetal growth restriction, premature birth, stillbirth, neurological problems. Can I tell if my baby is sleeping based on movement? Not definitively. Babies have periods of activity and rest. What is the relationship between fetal movement and labor? No direct correlation. However, decreased movement in the later stages of pregnancy might warrant further investigation. Does fetal movement indicate a healthy pregnancy? Generally, yes. Consistent and active movement is usually a good sign. Can I feel my baby's yawns or stretches sometimes? You might feel subtle shifts or changes in movement patterns. What is the role of the placenta in fetal movement? Crucial, the placenta provides oxygen and nutrients to the baby, which are essential for growth and movement. Can I feel my baby's reflexes sometimes? You might feel sudden jerky movements that could be reflexes. How does fetal movement change as the pregnancy progresses? Early, gentle flutters; mid-pregnancy, more vigorous kicks, jabs, rolls. Late pregnancy, movements may feel more constrained due to less space. What are the best positions for feeling fetal movement in the third trimester? Lying on your left side, sitting upright, gentle rocking. Thank you for staying with us until the end of this video. If you enjoy our videos, please give us a like, subscribe to the channel, and share your thoughts in the comments. Let us know what you'd like us to make videos about next.